All right, let's take a look at this. Now, this model, I know we only usually have it at Oak Creek. I like this model because it shows a couple things a little bit blown up. One of the things you'll notice right away is that in this model, you'll see a very large crista galli telling us right away that we're in the area of the ethmoid bone. This is the frontal sinus. This is a very blown up version of the sphenoid sinus. And again, this is part of the ethmoid bone coming down. So you have the superior and the medial conchas. When we open this up, you should also see, hopefully we can open it up, we should be able to see the ethmoid sinus as well. So the openings right here are the openings to the ethmoid sinuses. So in this view, we can see all three sinuses. The only one we can't see is the maxillary. You can see the concha, you can see frontal, sphenoid, and down here, you can see the separation between the oral cavity and the nasal cavity. This area right here, this is your hard palate. Remember, most of the hard palate, 2/3, is formed by the maxillary, all right, by the maxilla or maxillary bone. And we can see it here. The other third of the hard palate is by the palatine bone. So here's a palatine bone, here's the maxillary portion of the hard palate. Now, on the other side, and that's why I like this, you can also notice that you can still see the crista galli, and then you can see part of that ethmoid bone coming down, helping form the separation between the left and right nostrils, right? So that separation between left and right nostrils, we can see, what we see of it when we're alive is the nasal portion of the septum. So here's your septal cartilage, and it's going to be anchored by two bones. This area number 3 is part of the ethmoid. This is called the perpendicular plate. This is the vomer, right? Now, as we go down right here, this is the opening to the eustachian tube. That is pretty large on this model. And then this big old thing right here, that's your pharyngeal tonsils. So let's take a look at on a smaller view right here. So on the smaller, you see the frontal, you see the sphenoid, all right? You see the crista galli, you see the superior and middle conchas, inferior concha. You see here, you see that opening to the eustachian tube. Over here, you can see the pharyngeal tonsils or adenoids. As we move down, right, this is the soft palate turning into the punching bag called the uvula, right? So air has to go through this opening between the uvula and the, right, this small area we call the nasal pharynx. So air has to go through there, and as it goes through there, it's very restricted. You can imagine if you're laying down, gravity will pull on the uvula downwards and even restrict that air movement. This is called the internal nares. The nares, internal nares, is where air moves as it moves from the nose into the nasal pharynx and hopefully down into your, right, your trachea. Now, what else do we notice here? You see over here in the junction between the nasal pharynx and the oral pharynx, you see another tonsil. This is a palatine tonsil over here. Palatine tonsil, nasal pharynx, oral pharynx. Next, in front of it, you see the lingual tonsils. Not sublingual gland, these are lingual tonsils right here. Here is your tongue, and this is the genioglossus muscle helping you move the tongue. Geniohyoid muscle helping form the floor. Most of the floor is by the mylohyoid over here, which is number 46. Flat sheet-like muscle covers a span of the mandible, so then you can form the floor. All right, now what else? As we go from this area of the oropharynx downwards, it's going to separate, right? And at the start of the epiglottis to the thyroid cartilage, this area is called the laryngeal pharynx. As we go down the laryngeal pharynx, we're going to split then into respiratory on one side, food on the other. Before, both the nasal and the oral cavities will be allowing air. You can mouth breathe, you can nose breathe, and food matter to enter. Yeah, we normally don't eat through our nose, but in emergency situations, we might have to put a tube down your nose so then we can suction alcohol out, toxins out, things like that. Even put an NG or a feeding tube, right? So yeah, they're all connected, and then it starts to separate right here at the laryngeal pharynx region. As we go down the laryngeal pharynx, then you can see This area is going to go to the respiratory. This is going to turn into the esophagus and into the digestive system. Now,